My name is Jenny Feliciano, and I will be presenting on mindfulness and meditation in therapy. Recent studies show that mindfulness and meditation have reduced or eradicated intrusive symptoms associated with trauma. Therapists have implemented meditation with trauma survivors, showing promising results. One study reported that meditation reduced judgment, anxiety, depression, and hyperarousal symptoms. And as a result, trauma survivors were able to self-regulate when they experienced intrusive thoughts. So what is trauma? Emotional and psychological trauma is the result of extraordinarily stressful events that shatter your sense of security, making you feel helpless in a dangerous world. Trauma can result from one-time traumatic event or a prolonged exposure to sexual, physical, emotional abuse, and/or neglect. It is important to note that people can respond differently to such events, and while one experience may be perceived as traumatic by one person, it may not by the other. Therefore, trauma can be subjective. The physiology of trauma. So when people perceive a threat, signals from the amygdala to the hypothalamus activate the sympathetic nervous system, which causes adrenal glands to release epinephrine and norepinephrine in preparation for fight or flight. Once the perceived danger is over, the hypothalamus signals the pituitary gland to release cortisol, stopping the alarm reaction and returning the body to a normal state. The limbic system of a trauma survivor may become dysfunctional, causing arousal even when there is no danger present. And even smells, sounds, and memories can trigger these alarms, causing a trauma survivor to feel as if they are in danger when they are not. The purpose of this research project is to study whether introducing a mindfulness and meditation treatment plan will have any effects on levels of anxiety and depression, eating disorders, and suicide, which resulted from prolonged bullying beginning in early childhood and exposure to domestic violence. The target population intended for this project is a 16-year-old adolescent who identifies as female, who is Hispanic American of Guatemalan descent. She has experienced anxiety and depression that began when she was bullied for her weight. During this time, she also had disruption in care and attachment losses. Years later, she began restricting food and having binge eating, purging behaviors. The intervention treatment plan was implemented twice a week. It consisted of a body scan at the beginning of each session where attention was given to a specific body part in a head-to-feet order, followed by an imagery grounding prompt. During the body scan, the client was asked to bring awareness to any feelings and thoughts that were present and to acknowledge them with no judgment. Part of the intervention was to set an intention and say it in her head a few times. Lastly, the session ended with a 5-minute silent meditation, noticing the breaths during each inhale and exhale. These are the 7 questions that were asked in the pre- and post-test survey. How sad have you felt? How anxious have you felt? How much negative body image have you experienced? How often have you binged or purged? How often have you experienced anxiety around food? How much self-judgment have you had? And how hopeful have you felt? Here is a chart depicting the pre- and post-test results. As you can see, anxiety, sadness, and self-judgment symptoms went down. Body image and food anxiety remained the same. Interestingly, she reported no binge purging behaviors in the pre- or post-test self-report. There was also the improvement in hopefulness. As far as my own observations during this research, the client appeared tired, lacked motivation and did not smile much. After implementing the intervention, she appeared happy, she smiles often, and has begun doing schoolwork, which she did not in the past. She also reported cleaning her room and waking up early on a daily basis, in addition to walking her dog every day. And also the relationship between she and her mom has also improved. It is recommended that studies regarding mindfulness and meditation be conducted in a controlled environment. It is possible that the results that I got may be attributed to the fact that the client is taking antidepressants. Another factor to consider is that much of her anxiety stems from being in public places, and due to the current conditions, being out in public is currently not recommended. Thank you so much for your time. Here are some useful sources to consider if you would like to explore this topic further. Thank you so much again, and have a great day.